Hi, Dr. Windisch from Sparks Pediatric and Adolescent Medicine again. Welcome to our video series for parents. Please remember that today's video isn't intended to replace visits with your physician. Uh, if you have questions, we're happy to see you here in our office at 775-359-7111. But realize we can't really answer questions over the telephone or the internet. That's not in your child's best interest and not really something we're in a position to do. What we want to talk about today is the various types of mental health professionals that are out there and what their differences are, because there seems to be a lot of confusion, at least in my patient population, as to who does what for kids. So the first person we want to talk about is the pediatrician. That's me. General pediatricians have a lot of background in child development and a certain amount of background in child psychology and child psychiatry. We definitely can treat certain mental health diseases, such as depression, attention deficit disorder, etc. But by no means are we psychiatrists. Some pediatricians are more comfortable with these diseases than others. Some pediatricians won't treat ADHD, others treat a lot of it, such as myself. But there are limits to what we can do and limits to our own knowledge. So we utilize a lot of allied health doctors to help. Physician number 2 is the developmental pediatrician. These are pediatricians who've done an additional 3 years of training in developmental pediatrics. These doctors have a lot of experience with ADHD and Tourette's disorder and depression and autism, childhood disintegrative disorder, etc. And they're very good at what they do. But again, they're not psychiatrists by any stretch of the imagination. They're very good when there's mixed neurologic problems and can treat many of the problems that you have, but they're not counselors as well. And there are limitations to what they can and can't do for you. But there are limitations to what everybody can and can't do for you. The next mental health professional is a psychiatrist. These are doctors that prescribe medicine. They are MDs or doctors of osteopathic medicine, like I am. They went to medical school. However, instead of doing a residency in general pediatrics, they do a residency in psychiatry. These people can prescribe. They do know a certain amount about counseling. But first and foremost, they're prescribers and they're physicians like I am. So their main modality of therapy in general is medical therapy. They're experts in the use of all psychotropic medications. So whereas I treat some depression and much ADHD, they treat the most complex cases of ADHD, suicidal patients with depression, schizophrenia, bipolar affective disorder, and so on. Whereas I treat a certain amount of those things and also provide you vaccines and provide you with help for asthma and allergies. They don't treat the asthma and allergies, they don't provide you vaccines, but they treat a much broader spectrum of mental disease, including severe mental health issues that I don't delve into because it's outside of my area of expertise. They don't do a lot of counseling. They're trained in a certain amount, absolutely, let there be no doubt about that. And in fact, the person who really developed the talking cure as we know it, Sigmund Freud, was a psychiatrist. But most psychiatrists don't do a ton of psychotherapy. Instead, they employ in their offices or as a referral source other people to do the talking cure, and that's what we want to talk about next. So the next mental health professional that's out there is the psychologist. These people either have PhDs or PsychDs in psychology or child development. They do not prescribe and by definition cannot prescribe. When you go to see them, what you get is the talking cure. Their job is to help you to work through your problems, to address them, and hopefully solve them, or at the very least make them manageable. Who's better? Neither. They're very different approaches to the problem, and the reality is most people with mental health issues need to see both. You need the medicine to stay functional. You need the psychologist to help you figure out how to keep your life moving forward. And that's something people seem to have a difficult time getting their hands around. Well, I see a psychiatrist. No, you see a psychologist. You need medicine. Or conversely, well, I see a psychologist. No, you see a psychiatrist. He's giving you medicine. You need therapy as well. They're going to help you to keep your family functional, to keep everybody living together in harmony, and to get your child through school. You can't replace one with the other. The next major professional are therapists. These are people who are master's prepared. They either may be licensed clinical social workers, LCSW, or marriage family therapists, MFTs. There's a couple of other credentials that may show up in there. But they have graduate education in the field of psychology, and they can help with the talking cure too. There are limits to what they can and can't do, but especially when the difficulties with interpersonal relations, they're very good at what they do. With regards to dealing with depression and certain severe personal disorders, they may or may not be able to help you, but when it comes to family dysfunction, they do probably a better job of handling family dysfunction than do the psychologists, because their area of emphasis is the individual, not the entire family. Within the psychologic realm, there are lots of different schools of therapy. Most therapists and psychologists employ actually a variety of techniques that they use, but one therapist and one therapy technique is not interchangeable with the next. And what didn't work for one person doesn't work or will work for the next. So I hear this from time to time with my patients. Well, we've taken them to a psychologist before. That was a waste of time. We don't want to go back. Well, perhaps you need to find another psychologist who uses a different therapy technique, because they're not all interchangeable. Unfortunately, I run into that with insurance companies too when I want to send a patient to a specific therapist or psychotherapist or psychologist. And the insurance company says, well, you know, we've got 5 on panel. We're not going to pay for you to see Dr. X because these others are all good. Yes, but they do different types of therapy than what this child needs. And the insurance companies don't understand that they're not interchangeable as well. But I can't, unfortunately, educate the insurance companies. They're about making money, not about providing you health care. There are lay therapists as well. I counsel people to stay away from them, realistically. There are the school counselors. Now, these people do have backgrounds in counseling, but they're not psychotherapists by any stretch of the imagination. Their bigger job is to keep you in school and to guide you through the proper classes to take and which ones will work for you, considering your intellectual functioning and area of expertise and areas of interest, and to help you with basic things like navigating the school system. But when it comes to kids who are horribly depressed or who are having significant behavioral issues, seeing the school counselor is not sufficient. They don't have the time or the educational background to be a psychotherapist. Yeah, they're free and they're available, but you get what you pay for. And that's not their area of expertise, and it's not their background. And I know my friends who are school counselors are often frustrated because they have students who come to them and refuse to see a psychologist or a psychotherapist for any of a number of reasons and insist on getting all of their therapy from the school counselor, and that frustrates my friends, the counselors, who feel that their patient's not getting, their student is not getting appropriate psychotherapy, and they're limited. And then there are religious counselors. Now, some of these people have a background in psychotherapy, and in fact, quickly coming to mind are 2 therapists. One therapist who's a very good friend of mine, one that I don't know very well, and one who is a professor of mine, who are priests or ministers within their religion. That is their primary line of work, but they, on the side, have either PhDs or master's degrees in psychotherapy. But I do counsel people to steer clear of receiving psychotherapy from religious leaders who aren't trained psychotherapists. Religious leaders are experts in religion, and they should guide your religion. But if you're having personal problems that require a mental health professional, see a trained mental health professional. Now, if your minister is a trained mental health professional, such as my friend down the street who is a Baptist minister and a marriage and family therapist, or my professor, Father Warnke, who is a marriage and family therapist as well as an Episcopal priest, or some of the other people who come immediately to mind who have backgrounds in psychology or even psychiatry and are priests in various religions or ministers in various religions. That's okay because they're trained, they can help you, but you definitely, if you're having issues and need to see a therapist, see people who are experts. This is your mental health we're dealing with, and if you try to cut corners, you again get what you pay for, and you will pay the price for having cut corners. I hope this helps you to understand the difference between the various professionals that are out there, and I hope that it helps to straighten things out for you. Again, my goal is not to point fingers at anybody. My goal is not to put anybody down. We're not being critical here. But you do need to understand the difference in backgrounds between the various professionals, because some, depending on what your needs are, some will meet your needs better than others. And we certainly don't want to see patients frustrated or getting suboptimal care. This is Dr. Windisch from Sparks Pediatric and Adolescent Medicine. If we can be of assistance here, please call us at 775-359-7111. We'll see you next time. And we'll see how this format works out.